Hi, Dr. Lindsey and Wendy here. This is a real brief video. This medical doctor of Middle Eastern descent came in just recently. He's 47 months out from when we first got a hold of him. And here's his hairline at the beginning. Again, he's a great candidate for hair transplant because he's got thick, wiry, bushy hair that just grows and grows and grows. It's awesome hair. And he had low density in each of his triangles and a little across the front, and we did an FUE on him. I don't remember how many grafts we did on him, but we packed those corners and a little bit across the front. And then unannounced today, he walked in and showed us his results at 47 months. And so he looks awesome. He inquired whether he needs to have some more done, and the answer is no, not right now. He's a younger guy, and he's almost certainly going to lose more hair, but this is a great example of what FUE can do for you, particularly that thick, wild Middle Eastern hair, which grows.
So this is a result of our FUEs with a good candidate.
Yeah. So there's lots of videos where we talk about how FUE never works as well as strip does, and it doesn't in him, but that thick, fat-rooted hair, if you're going to do FUE, that's the guy.
That's the one to do it, and then you get success.
Yeah. So if we can help you, give us a call. Thanks.